If you are a treating physician, you will often need to check positions of several tubes on chest x-rays. If you are a radiologist, you will often have to describe positions of these tubes on your reports, along with other pathologies that you may see on a chest x-ray. Most of these tubes are made up of plastic with radio-opaque material inserted into them, so they may become visible on an x-ray. Most important of these tubes are endotracheal tube, nasogastric or orogastric tube, simply are known as NG or OG tube. Depending upon the site of entry, if it is entering from nose, it is known as nasogastric, or if it is entering from mouth, it is known as orogastric tube. The other types of catheters that you may see are drainage catheters, and you may see several types of central lines. Yellow arrow points to the tip of endotracheal tube. ET tube, as it is commonly known as, is inserted from mouth into trachea and indicates that the patient is on artificial breathing. Other end of this tube is attached to a machine known as ventilator. A blue arrow indicates a spinous process of the first thoracic vertebra. We know it is first thoracic vertebra as the first rib is attached to it. If you count the spinous processes, the tip of the endotracheal tube is at the level of third thoracic vertebra. The tip should be above the level of carina or above the level of bifurcation of trachea, so the air could go into both lungs. If the tube is too far in, it will go either into right main bronchus or left main bronchus and will block the supply of oxygen to the other lung. The other lung as a result will collapse. Now the bifurcation of trachea is usually at the level of T6, sixth thoracic vertebra. If the tip of the endotracheal tube is above bifurcation, it is said to be satisfactory position. Yellow arrows are pointing to end holes of two drainage catheters. One is inserted into each lung. Drainage catheters can be used to drain pleural effusion, pneumothorax, and hemothorax. Each of these catheters has a side hole which is pointed by blue arrows. Both holes should be within the thoracic cavity. If one is outside, the tube is not gonna serve the purpose. Now this is probably a wire which is over the patient's body rather than inside. In my understanding, it may be the wire attached to the oxygen saturation monitor. Yellow arrows are pointing to nasogastric tube or NG tube, which is inserted from nose, as we discussed before. It passes through the esophagus and should end up in the stomach. The main purpose is usually feeding. It is also inserted in case of intestinal obstruction in some patients. The lower arrow is pointing to the distal portion of the nasogastric tube, which is in the stomach. Yellow arrows in this slide are pointing at a central line. Central lines are inserted into a large vein, and the tip of the tube is checked radiologically and should be in superior vena cava or in right atrium or at the junction of superior vena cava or right atrium. The point of entry is either right or left subclavian vein or right or left internal jugular vein. They all end up in superior vena cava or in right atrium. The purpose of these lines is to have a direct access to a large vein to introduce few medications which are not recommended by small veins like dopamine, for example. CVP line, for example, is also used to measure central venous pressure. Porta catheter is inserted into cancer patients for a long-term access. A central line is also used to infuse concentrated solutions with decreased risk of complications. Common examples of central lines are CVC or CVP. Same line can be used for two purposes. PICC lines, peripherally inserted central catheter, Porta cath, and Hickman's catheter. The tip of this central line is in the right atrium. There is a tooth as a foreign body in one of the bronchial branches on right side, which is indicated by yellow arrow, which could and can be pulled out using a bronchoscope. Teeth can often break away and end up in bronchi, sometimes during intubation. Other findings are consolidation in both mid and lower zones. Right heart border is not clearly visible, which is also known as positive celoid sign. This is another chest x-ray which is showing you the PIC line, and it would be really difficult for you to see this line on the video quality. You may have to download the actual presentation from the website, but the tip is ending up in the superior vena cava, and it is usually inserted from elbow, as in this case. The video is prepared for www.academyofprofessionals.com, and you can download this PowerPoint presentation from this website, and the quality of the x-rays is much better as compared to the video quality. And these are the references. Thank you very much.